Good day, everyone. Today we're going to be talking about Ebola hemorrhagic fever. Well, Ebola hemorrhagic fever is caused by Ebola virus, and this is the electron microscope, or this is the electron micrograph of the Ebola virus, right? So essentially Ebola virus belong to a group of virus called the Filoviridae, right? Right? There's other viruses within those group, yeah, but the ones that are commonly talked about is usually the Ebola virus and the Marburg virus, which was discovered in Germany, in Marburg, Germany. So Ebola virus, there are essentially 5 strains of this virus. You have the Boundy Bio Ebola virus, you have the Reston Ebola virus, you have the Sudan Ebola virus, and then you have the Thai Forest Ebola virus, and then lastly you have the Zaire Ebola virus. Essentially, in terms of Ebola virus, it mainly causes hemorrhagic fever. There are other forms of hemorrhagic fevers out there, but some of the common types of hemorrhagic fever that you likely to hear about is Lassa fever, prevalent in northern Nigeria. You have Hanta fever, Crimea Congo, Ebola hemorrhagic fever, recently in Liberia, Sierra Leone, even in Nigeria. You have the Marburg, which haven't been heard of since like in the 80s, and dengue fever, which is prevalent in the Caribbean. Transmission of Ebola virus. Essentially, there are 2 ways you can contact the Ebola virus. One way is through contact with animals, mainly infected bats or infected monkeys. As you know, some people eat them in Africa. It's a delicacy over there. You have the bats here, so if you obviously consume an infected bat or monkey, you can be exposed to the virus. Or human to human contact is another one. Being in contact with an infected person, you can also be exposed to the virus. Not necessarily being in the same room with the person, because it's not airborne. There have to be some kind of fluid exchange. It can be maybe sweaty pants, a dead body that is being washed as a preparation for burial. It can be blood. There have to be some kind of body fluid exchange for you to be exposed to the virus when it comes to human contact. So once the virus is inside your body, what exactly does it do? Well, it affects mainly a couple of cells, right? It affects monocytes, which give rise to macrophage. So it's going to target monocytes and macrophage, and that will essentially weaken your immune system. It targets the endothelial cells. So essentially, you can see the virus here, and that will infect, whether we talk about the monocytes or the macrophage, or talking about the endothelial cells, right? By damaging these monocytes, as a result, also macrophage, you're essentially weakening the immune system, especially response to things like bacteria, etc., right? But you also damage endothelial cells, right, which is going to pretty much cause the blood vessels to be leaky, and red blood cells will be able to leak out from the blood vessels instead of being contented in there. That's where it gets the name hemorrhagic fever. You see blood. So in terms of that, right, so that explains why you get all the hemorrhage. One of the common symptoms of Ebola. You might be bleeding from the body orifices, or even on the skin, like the hemorrhagic rash, etc., because of the endothelial cells essentially damaged, because the virus itself infects the endothelial cells, replicates in there, and it lyses itself out and thereby destroying the endothelium. And the same goes with the monocytes, which essentially weaken your immune system. These are a couple of the symptoms of Ebola, and you can see that it's going to pretty much mainly boil down to these two things here: damage to endothelial cells and damage to monocytes and macrophage. You can see here you have the skin rash. Obviously, if you damage the blood vessels supplying and blood to your skin, you won't get the hemorrhagic rash. You have the stomach pain / vomiting. You get pharynx and lungs problem, hiccups, sore throat, difficulty breathing, difficulty swallowing. You get headache, which would just be a sign of general fever. You get the red eye, right, which is a hemorrhage, right, bleeding into your eyes, right. You know, the sclera, you might see hemorrhage on the sclera. Systemic symptoms, you can see fever, lack of appetite, internal bleeding because of the hemorrhage, right. It can't seem to contain blood within your vesicles, within your blood vessels. It can't seem to contain blood within your blood vessels, so essentially they're leaking out to any way they can. Internal bleeding, so you're going to see a hemorrhage on organs, etc., right. Muscle weakness, aches, joint pain, joint aches. You might even see diarrhea in there, right. So those are the symptoms for Ebola hemorrhagic fever. In terms of management of Ebola hemorrhagic fever, essentially there's actually no current prescribed therapy right now. What you can actually do is just to, you know, manage the symptoms. You know, for example, if someone has the fever, you know, you can prescribe acetaminophen, and you know, or in some other countries it's called Panadol or paracetamol. In the United States, it will be mainly like Tylenol. You can give that, you know, to bring down the fever. You know, for example, someone have diarrhea, you know, you can give anti-diarrhea medicine like Imodium, etc. So it's just essentially maintaining the symptoms. And you have this one here, right, that is you know, that has been recently in the news, used on those two Americans that came back from Africa infected with Ebola, the ZMapp. Essentially what this one does is a monoclonal antibodies, right. Essentially what it does is essentially, right, is a monoclonal antibody. Essentially what it's going to do is going to bind to the Ebola virus, right. It's going to bind to the Ebola virus, and by the ZMapp monoclonal antibody binding to the Ebola virus, essentially it prevents the virus from doing these guys, from infecting these cells. It can infect the monocyte, obviously, since the ZMapp is bound to it, and it can also infect the endothelium by the ZMapp binding to it, right. So essentially what you are doing there is that you prevent viral entry into cells, therefore viral replication. And obviously if you don't have viral replication, the viral itself is hot, and over time your immune system will clear them out. But the only problem there is that since the virus also weakens the immune system, ZMapp will only be effective in someone that is young and already have a robust and functioning immune system prior to the infection. Obviously if you are old and your immune system was already weakened to begin with, ZMapp might not do you any good, because the virus is probably going to weaken the immune system a little bit more, and even after you've arrested it, it might take, even if you do recover, it might take a longer time for you to recover, because your immune system is already weakened to begin with. But for someone that is young and robust with a more active immune system, the immune system is likely to pretty much fight the virus and clear them out once you use something like ZMapp to arrest viral replication. And that concludes our discussion on Ebola hemorrhagic fever. Hopefully I've been able to clarify some issues. Thank you.